there's information out that has indicated that individuals who have died sought out medical attention early enough that doctors should have been able to treat this illness, yet the individuals died anyway. Can you speak on that?
Yeah, I can comment on that. Yeah, that is scary. It speaks to the severity of what's going on. These patients got sick very fast, and so they knew they had to get to the doctor quickly. That brings up the point that they got sick fast and got to the doctor early, but they still, some of them still died. I cannot comment personally on those cases because I wasn't the caretaker. But however, as we mentioned previously, most cases of severe respiratory illness are pneumonia, and so doctors made their clinical judgments, as I'm surmising, and treated it as a bacterial pneumonia. Many of the patients that presented who did not respond to antibiotics initially eventually responded to anti-inflammatory corticosteroids. So they weren't getting better, and the doctors tried something else, and that helped. When caring for acutely ill people, the most effective treatment is very dependent on making an accurate diagnosis. The healthcare providers in these cases were facing the challenge of treating a condition that was new to them or caused by products that are relatively new and have not been deemed safe, FDA approved, or for which long-term safety are not yet known. Investigators are still seeking a clear mechanism or cause of the illness. All that is known so far was a clear association with vaping, nicotine, THC, or both. So until more is known, the recommendation is to not use any e-cig products. So to summarize again, these people presented very ill. The doctors treated what they clinically thought most likely was pneumonia, but the patients didn't get better. And so they had to switch gears. And again, I can't comment on those cases because I wasn't the caretaker, but what I see is that these doctors were facing a challenge of dealing with something, again, that was new. So I personally, this month, and many doctors have already received from our respective professional organizations blitzes saying there's something new out. If you see this, you have to consider a new diagnosis and make sure you ask about vaping and e-cigarette use. So it's sad to say that these folks died, but maybe a very callous way to put it is that it was a new condition and they were the guinea pigs. And so we don't want to make that mistake again. Hence, the blitz, the doctors, look out for this. If you see it, consider alternate causes besides bacterial pneumonia, and also report it to the CDC or your local health departments, so that if we run across it again, we can address it and more people can survive. But that being said, because it's a new scourge, we don't necessarily have the best treatment options for it. We would still be developing the best evidence-based algorithms or protocols on how to treat vaping-related acute respiratory failure. So if you vape or smoke e-cigs, you do so at your own risk. You're going to show up at your doctor's office, and we're going to use make the best clinical judgment that we have. But we would still need to gather more information to know what is the best way to treat this. So if you want to be part of that study and help us find out, smoke the e-cigs, get sick, come in, tell us you smoke these cigs, and we'll add you to our pool of data to figure out how to treat more efficiently the next guy or gal who comes down the line smoking e-cigs or vaping. So I think that's probably what happened. The doctors were just faced with something new and were making the best clinical judgment at the time. And it was a new condition.
Well, I would like to again thank Dr. Ramos for coming with us today and answering our questions. Well, I've learned a lot today.
Blane, it's my pleasure, and it was fun. I hope it's useful. Thank you.